Good afternoon, everyone. My name is Stacy Stewart. I'm President and CEO of March of Dimes, and we are so pleased to have you all join us this afternoon for this incredible Facebook Live session, a continuation, actually our 8th installment in the Healthy Moms, Strong Babies Facebook Live series, brought to you by the March of Dimes. And we're certainly going to have an incredible conversation today. Today, the focus is really going to be around the warning signs for women who are pregnant, women who are in the postpartum phase, after the baby comes, and when a woman should seek help from a healthcare provider or doctor, especially during this pandemic. We are so thrilled to have our guests with us, and I'll be introducing them in just a minute. We're also really grateful for the generous support of Merck through its Merck for Mothers initiative. So thank you, Merck, for all of your great support, allowing us to come to our live audience. Want to make sure that all of you all remember that your questions as we go through the conversation, we'll be able to see your questions. If you want to put any of your questions in the chat box, we'll be able to see that. I'll make sure that all the panelists have a chance to answer your questions directly. We know that a lot of you all are really concerned about some of these issues right now about what to do if I think I need to go see the doctor. How do I know I need to go see the doctor? Something's wrong with my pregnancy. I'm not quite sure. What do I do? Or I just had my baby and I've got some things going on. I'm not quite sure what to do. Should I call my doctor or not? So those kinds of questions are what are really on the minds of a lot of women today. And we want to make sure we get a lot of your questions answered. One of the things we're going to do, though, is just start with some context and then lay out some of the challenges that we're seeing. A lot of folks that follow the March of Dimes really know, certainly our panelists know, that we, even before the pandemic, were in the midst of a pretty urgent maternal and infant health crisis in the U.S. The U.S. today is considered the most dangerous developed nation in the world in which to give birth, and that's really shocking to hear. But now, especially with a pandemic layered on top of it, it's made having a baby, which should be the most precious and wonderful time of life, or just becoming a new mom, it's made it incredibly stressful. And so what we want to make sure at the March of Dimes that we're doing is certainly providing the right kind of support and information to women to make this journey of motherhood as easy as possible. But this infant and maternal health crisis that we've been in has been a challenge for a number of years. We know that in America, there are so many women who face any incredible challenges and some barriers to having a successful pregnancy and a healthy pregnancy, making sure that they're healthy as the mom as well as the baby is healthy. We know many women in this country face chronic health challenges like high blood pressure, diabetes, chronic heart disease that can make pregnancy even more challenging. We know that also there are women who were considered healthy before their pregnancy and then become pregnant and then have some health challenges be exacerbated by the pregnancy, and they experience those health challenges even after the baby comes. Even after birth, the risk of hemorrhage or post-delivery bleeding can be a risk for so many mothers. So many moms can experience infections that can lead to sepsis and so many challenges. Of course, we know that the vast majority of pregnancies go extraordinarily well. And it is really in these unique situations when we do have to make sure that women get the care that they need. And so we don't want to concern women during this period of time, but we do want to make sure that you're armed with the right information so that you can advocate for yourself and so that we can protect more women. One of the things that the March Times did in this past year is launch a campaign called It's Not Fine. Because we think it's not fine that 700 to 900 women die from pregnancy and childbirth every year. And it certainly is not fine that another 50,000 of them come close to death or are considered near misses. It's also not fine that we have 1 out of 10 babies born prematurely every year. And so our job at the March of Dimes with our partners and our friends and all of you is to do something about that. And we want to make sure we reach every single mom and every single baby so that these unfortunate tragedies can be prevented. So we've had these challenges, but now we have the pandemic. So now there are additional questions for many pregnant women who are worried about even going into the doctor's office. They're worried about showing up at the hospital. They may be having some challenges or some symptoms, and they're not quite sure whether or not this is really something to be really concerned about, or is it something that's more in the normal course? And of course, now is a very challenging time, not just to be pregnant, but just to be in this world right now, in this pandemic, where so many people have lost their jobs. They may have lost access to healthcare, or access to the resources they need to get the care that they need. They may not have access or have limited access to public transportation. And there is telehealth available for some women, which is a great resource. But how do we know when my condition? How does a woman know when telehealth may not be sufficient and she may need additional care? What about if I don't have access to telehealth? What if I don't have access to broadband? What do I do in those instances? So there are just so many questions today. I'm really pleased our panelists are here today to help us answer some of these questions. Our panelists are going to be able to discuss what symptoms you might be experiencing, what you have to do to pay attention to them, to respond to them, to get someone else to respond to them. Again, if you're pregnant or if you're in the postpartum phase, we want to make sure that our panelists are able to help you understand how extremely important it is to advocate for yourself and to know how to advocate, to know how to do that effectively. I also want to make sure that we're clear about the fact that in addition to all of the medical and other kinds of challenges that women face, there are so many other things that have to be taken into account. A woman's mental health can often be causing complications in her pregnancy or after. And we also know and are very clear on the fact that our maternal and infant health crisis is not affecting all women in the same way. We know that women of color are disproportionately impacted. We know that there's a significant amount of implicit bias that is built into our system that really needs to be addressed and rooted out. And we want to make sure that all women, women of color and all women, have the resources, the tools, know how to advocate for themselves, to know how to protect themselves and their health and their baby's health as well. So in addition to the comments and the questions you can put in the comment box, I want to make sure you know that there are people, staff, that are able to put a lot of links and a lot of answers into the chat box as well. So you can always refer to those as we move through the conversation. So now to get started and introducing our panelists. I'm so excited to be with them. They're absolutely awesome. I'll introduce them and then we'll have a chance to talk for a bit, and then we'll get into some of the questions from the live comments as well. First, I wanted to introduce Sarah DiGregorio. Sorry, Sarah. Sarah is actually a great friend of the March of Dimes, and she was so kind to send me her book. I really appreciate it because she has written an amazing book that is called Early: An Intimate History of Premature Birth and What It Teaches Us About Being Human. She's a journalist, she's a preemie mom. She writes about her own experience of having had a premature baby and what she saw through her journey of pregnancy and caring for her baby in the NICU. So Sarah, we're so glad that you're here to share your story. Dr. Sindhu Srinivas is a maternal fetal medicine specialist who is the director of obstetrical services at the hospital of the University of Pennsylvania. And as if that wasn't enough, she's more than that. She's vice chair of quality and safety of the Department of OBGYN. She's associate professor of OBGYN and a co-founder and medical director of a really exciting program called Heart Safe Motherhood. And I know Dr. Srinivas will talk about that. Eleni Sigas, CEO of the Preeclampsia Foundation, a great partner of the March of Dimes, doing some amazing work addressing this major challenge that so many women face around preeclampsia. And I know she's going to talk a little bit about the risks of preeclampsia, how to recognize it, what to do about it, what should be done about it, and how we can avoid so many women from falling victim to preeclampsia, affecting them and their babies potentially. And certainly last but not least, Dr. Cheryl Roth, a doctorate prepared women's health nurse practitioner and the immediate past president of another great partner of the March of Dimes, AWON, which is the Association of Women's Health, Obstetric, and Neonatal Nurses. So Dr. Roth, Sarah, Eleni, and Dr. Srinivas, thank you for joining. And let's just jump into it. I want to start with Sarah. Sarah, I mentioned you wrote this incredible book and you documented and told your story, and it was very compelling. And I think a lot of women would really want to know more about what you experienced and how you worked your way through that experience and how you sought help and advocated for yourself. So give us a little bit of insight about your book, what you wrote about your experience as a NICU parent, and your journey.
Thank you so much, Stacy. It's such a pleasure to be here with you, and appreciate the work the March of Dimes does so much. It means so much to families like mine. Yes, as you say, I went through premature birth. I was actually also born prematurely myself, and then had my daughter at 28 weeks. And so the experience has a lot of resonance for me. I had a lot of questions, and that was really where the book came from, was out of all of my questions. And I will say that that is sort of a theme throughout my pregnancy. I did struggle to get my questions answered. I was very lucky that I had great care. I had a very good OB. But I think that, in many cases, our medical system is really not set up to have really good conversations between pregnant people and their providers. Often providers are very busy. Often what I heard was, oh, don't worry, don't worry. That's normal, that's okay. And I never really felt like I understood exactly why I shouldn't be worried. And I think that that's important, because sometimes what I felt myself and what I hear from other women is that, you don't want to be a bother. You think like, oh, it's probably nothing, but really you have this worry in the back of your mind. And I really want to say to people that you don't have to be alone with that. Your provider really can be a partner for you. You deserve to have your questions answered and your concerns heard, even when maybe there are no good answers. That's okay. To even to hear your doctor say, we are not sure, but we're going to do our best. So what happened to us was that we had a blood, our 12-week blood test came back that there was a concerning a low level of something called PAP-A, which is a protein that the placenta is supposed to make. And what that meant was I was at risk for placental problems. So intrauterine growth restriction, premature birth. And I was very worried about that. I had had a miscarriage, as so many women do. I had kind of constant headaches. So I had a challenging pregnancy in that respect, even though in many ways I was very lucky. So I was being monitored for growth, because we knew that I was at risk for growth restriction, which just means that the placenta doesn't give the baby what it needs to grow, and that's dangerous. And so at 28 weeks, we had a growth scan that showed that my daughter had fallen all the way off the growth curve, and she was below the first percentile. So at that point, I was monitored in the hospital and then sent home. And I was told that I should count kicks, and that if I didn't feel any fetal movement, I should come back right away. And that was a scary thing to hear, to sort of go home and be like, I never felt very much movement. I think sometimes women don't. And the day that, actually 2 days later, when we were at the very end of our 28th week, I suddenly couldn't feel her moving at all. And I did all the things that I had asked about. I ate a cookie, I drank some juice, I lay on my left side, I tried to see if I could get her to move, couldn't. So we rushed back to the hospital, and they discovered that she was in distress. And so from the time that I realized that she wasn't moving to when she was born was maybe 2 hours. So it was very, very quick, very scary. And she was in the NICU. She was in the NICU at NYU Langone for 2 months. And she's a kindergartner now. She's doing great. Hopefully you won't hear her.
It's okay if we do, though.
But, out of this experience, I just felt that I had so many questions, and that this was such a rich topic, and that it happens to so many families. And that's really where the book came from, was just my effort to both tell my story, to tell the story of other families, and also to really put things in context and to try to understand better. Yeah.
You talk a little bit about, you had all these questions. Did you feel like when you were going through that experience that all the questions you had that you could answer, that you could ask, that you could get answers that you needed? I mean, did you feel like you were had a care team that was really able to address your concerns?
I felt that my doctor cared about me, and that she is a very good doctor. I think that in many cases there weren't good answers to my questions. And sometimes I think because we don't want to worry pregnant women, maybe sometimes the default answer is, oh, don't worry, it's fine. When but women can see through that, I think, a lot of the time. And it's not a satisfying conversation. It doesn't really feel like it answers your questions. And so I think what I would say now is, show up with a paper and pencil, honestly, write down what your questions are, write down what your doctor says. And if you don't feel that you are being heard or that you understand the answers, to really say that and to push for having more of a conversation. I think sometimes it's hard for doctors to admit, this is premature birth and placental problems are things that we are still researching and that we don't know a lot about. And sometimes the best that they can do is to really monitor you and hope for the best. And that's a hard message to deliver. And that's a hard message to hear. But I think it is a more honest message, and it's something I would have liked to hear.
And even if we don't know all the answers, it doesn't mean that you don't have a right to ask, right?
Exactly.
Yeah, that's great.
Exactly.
Dr. Srinivas, I want to turn to you. You're a maternal fetal medicine specialist. You deal with women with significant risk factors all the time. How do you coach and advise your patients in terms of advocating for themselves, what to look for if they're pregnant, and what to raise to the doctor or raise up if there's some concerns? And I think you're on mute, so you just have to unmute yourself.
Of course, that's a common problem.
That helps.
Sorry about that. Thank you again for having me. I'm honored to be here with this distinguished group of people. And Sarah, I really appreciated your comments. I think that you're right, Stacey. I take care of a lot of high-risk women, and just women in general have questions, as Sarah brought up, want answers. We don't always know the answers to all of the questions, and we have our sort of best recommendations around surveillance or education. I think one of the things that I always tell my patients is that I trust them and that I trust their gut. So if a patient of mine says, or if a patient I'm seeing says to me that something about this doesn't feel right to her and she's really worried, then that articulates to me that I need to do everything that I can to sort of make sure that I kind of evaluate all the things that she's talking about. And I think about preeclampsia a lot when I think about that statement, because as Eleni will talk about later, I mean, preeclampsia has a lot of different symptoms that come up. And sometimes, a patient knows their body best. So what I like to do is I think empowering patients to sort of know signs and symptoms of lots of things that can happen in pregnancy. So reviewing fetal movement, when you should be expecting certain kinds of movements from your baby and how often and how much, signs of preterm labor or early labor, early contractions, breaking your water early. So I guess I want to sort of frame this. These are things that I think we always talk about, but in this sort of setting of the pandemic, when we've shifted our care to more out of office care. And in some ways, I think that has led to a lot more sort of counseling and conversations, because women are at home and are seeing doctors and nurse midwives less in person. And we've shifted to that, I think, in a safe way, in terms of we're still doing in-person visits too. We're just trying to alter and sort of weigh the risks and benefits of sort of when a in-person visit's needed versus an out-of-office visit. But I do think we're spending more time also empowering women to understand some of these different signs and symptoms that they might feel or have.
And can you talk a little bit about that? Like, what are some of the symptoms? What are some of the things that physically could happen and that you would tell your patient, if these things happen, you must call me, you must come in, I want to see you immediately?
And part of this, I think, is couched by sort of what an individual woman's risk might be. So someone who has twins or triplets, or who has a prior preterm delivery, risk factors, that person's just at higher risk. And so these same risk factors apply, but I'm going to be a little bit more concerned in somebody that has some of those prior or, pre-existing risks. But things like, if you're feeling, depending on how far along you are, if you're feeling cramping, and I always describe it as your uterus. I have people feel their forehead and feel their nose. Like if your uterus sort of feels like your forehead, really, like it's getting really tight, sometimes that's painful, sometimes it's not painful. But if you're feeling like a tightening, and that tightening is coming here and there, that's okay. But if it's coming, more than 4 or 5 times in an hour and you're, still very early in your pregnancy, that's too much. And we'd want you to call. If you're feeling like you have an increase in discharge, or you're, aside from when you go to the bathroom, you're feeling like there's something leaking, or there's moisture that you're not sure about, that could be a sign that you broke your water. Bleeding. We certainly, I think especially now, I think women are trying to be so careful about when they should come in. And I think our messaging has been, with the pandemic, we want people to stay home as much as possible. But I think that there's also times that you have to come in. And I want women out there that are listening to hear, and families to hear, that it is safe to come in when you need to come in. And while we're trying to balance when you should come in, if any of these signs or symptoms are happening, those are certainly reasons and sort of necessitate calling your provider. And if you're asked to come in, while that might seem scary because you might have been quarantining yourself for weeks, that coming into the doctor's office where we're all masked and we're all really taking all these precautions and we're masking you, it is okay and safe. And sometimes it might be actually less safe to stay home if one of these things is really happening. And so I can't sort of stress that enough. We're spending a lot of time trying to just reassure people that if you have to come in, we want you to come in, and it's safe to come in. And it might be worse to stay home if if you're experiencing any of these things.
Absolutely. And Eleni, you are the head of the Preeclampsia Foundation and focusing on a very important condition, preeclampsia. Can you tell us a little bit more about what is preeclampsia and what are the concerns and the issues that go along with preeclampsia?
Preeclampsia is actually one of the main complications maternal complications that women may experience. So there is sort of a constellation of symptoms that women should be aware of. Let me back up though and say that probably one of the biggest things to realize about preeclampsia is that high blood pressure is probably the leading indicator that you've got preeclampsia, but it is still just a signal of it. It is not everything it is not the total description of what preeclampsia is. So what I mean by that is preeclampsia is actually a syndrome that affects many parts of our bodies. And the most important signal for it is that mom's blood pressure starts going up. And a lot of people don't realize this, that the whole reason current prenatal care was developed the way it was, you go and you weigh yourself and you pee in a cup and you get your blood pressure checked. The whole reason that was created was to check for preeclampsia. So in the old days, it was called toxemia. And I'm only saying that because some of you who are watching this may have heard that term and you're wondering like, oh, is that more dangerous or less dangerous? It's just an old term for what we call preeclampsia. Preeclampsia can also develop into eclampsia, which is the same thing with seizures. And there's also another variation of it called HELP syndrome, which involves, it's just a variation and often a much more dangerous variation of preeclampsia. So it is important though, because it not only affects mom, but it can affect the baby. So mom can suffer strokes, she can have a seizure. As I mentioned, it affects many organs of the body. So you can have your kidneys fail and liver and a whole bunch of things that obviously sound horrible because they are. It's one of the main reasons that moms die in this country. But it's also dangerous to the baby when she still has the baby inside, because it can affect the nutrition and the flow of blood that the baby's getting. And so when Sarah talked about having a growth restricted baby, one of the main reasons that happens is because of preeclampsia. So it's really important that the careful monitoring of mom and baby is done, so that if we need to deliver the baby, that we get the baby out in enough time. And sometimes even a preterm baby will do better outside the womb than inside if mom's got really severe preeclampsia. So these are all reasons that we pay attention, and one of the main reasons that we take blood pressure in pregnancy. So I can talk a little bit. Do you want me to mention some of the symptoms?
Yes, I was just going to ask you about that. Checking blood pressure is really important, but what are the other warning signs that a woman who's pregnant may need to be looking out for?
Yep.
With the risk of preeclampsia?
Yeah, absolutely. And let me give this little word of warning before I mention all these symptoms. Not any one of these means you definitely have preeclampsia, and you can have none of these and have preeclampsia. So if you weren't confused enough already, unfortunately, it is a syndrome because you can have a lot of these things and they come in different sort of flavors. But the main things that we look for is a headache. So you definitely want to be paying attention to a headache, particularly one that just doesn't go away if you pop a couple Tylenol. Any kind of severe chest pain or shortness of breath is a concern. If you are having nausea and vomiting in the latter part of your pregnancy, that's a concern. If you're seeing spots or auras, that's a concern. If you gain weight very rapidly, putting on a lot of fluid in your body, that's a concern. So these are all things. And a lot of people talk about swelling. And the thing that I would say is I'm not as concerned about fat ankle syndrome, but I am more concerned if you start seeing swelling in your face and in your hands, so upper extremity swelling.
And if any of these things, if you're experiencing these symptoms, especially even now during the pandemic, what would you be advising or telling women, or what information are you providing to women that they should do then?
Absolutely contact your healthcare provider and don't hesitate. I cannot reinforce enough what Dr. Srinivas said. In this time, and I'm going to say this pretty dramatically, your chances of getting very sick or dying from preeclampsia and not being seen are far greater than getting sick or dying from COVID, which is to say, do not let COVID keep you away from being seen. These symptoms need to be checked out. Your blood pressure, particularly if it's high, if it's over 140/90, you absolutely need to be contacting your healthcare provider.
That's great. And Dr. Cheryl Roth, I'm going to ask her to take herself off mute now so she can be all prepared. Thanks for joining us. And we've talked a lot about some of the warning signs like during pregnancy. But of course, we also want to make sure that women understand what to do even after the baby comes, right? Because so much, about a third of the maternal deaths that happen a week out to a year out after the baby has been delivered. And so the warning signs need to be followed, and women still need to be vigilant about their health even after the baby comes, even when they're going for baby wellness checks and things like that. So Dr. Roth, talk to us, and you're an experienced women's health nurse practitioner, immediate past president of AWHONN. Talk to us about what AWHONN is doing in this space, especially postpartum, and what are you advising women to look for in terms of warning signs, and what are some of the things that women really need to be careful about?
Thank you, Stacey, for including AWHONN in this work today. I'm honored to be with the others that are here on the call, and March of Dimes and AWHONN have had a long partnership together.
Yes, we have.
So very honored to be here. So one of the things that AWHONN is doing is that we created some time ago our post-birth warning signs, and I think you'll have a link for the people who are watching to be able to see the original article with the work on post-birth warning signs and our handout. And many hospitals now are using that as a tool for women when they go home, because when you go home after having a baby, you have a lot on your mind. And we wanted to create a tool that would make it easy for you to remember what are the things that you should call about. So we use the acronym POST and birth to give us an idea of what you should call for. I would remind people that with the COVID epidemic, there are some things in addition that you want to call for, and so we'll talk about those at the end. We also want to emphasize, as you said, Stacey, the risk for women to have increased incidence of intimate partner violence and postpartum depression because of the isolation due to the quarantine. And so we're also very concerned about that and really encourage women to speak up and to let someone know if they're struggling with in those areas. So the post-birth warning signs start with POST, which the first four are reasons after you've delivered or even before you've delivered. If you experience any of these, you should call 911. So the first P is pain in the chest. So chest pain, Second, O is obstructed breathing or shortness of breath, which of course, both of those are also COVID signs. S is for seizure, and that is one of the signs of eclampsia. And T is thoughts of hurting yourself or someone else. So that's POST.
So Dr. Roth, these, just to stop you right there, these are symptoms, and you're saying a woman should call 911 if she's
Yes,
experiencing
ma'am.
one of these things.
They
And
absolutely should.
even in the midst of a pandemic, not being afraid to call 911 if any of these things come up, right?
That's correct. And, you know, if you can manage, if you need to call 911, if you can manage to put a mask on before the providers get there, that's great. But don't hesitate. If you need to call 911, please do so. We want you to come to the hospital if any of those things, emergently, if you experience any of those things. The second 5, which are reasons you want to contact your provider, or if you can't contact your provider in a timely manner, you can go to the emergency room for any of these. The first one would.
Stacey, could I jump in and just add something to what she was saying? Because I think one of the points about preeclampsia that often gets missed, and Cheryl's points that she was just making really emphasize this. Historically, a lot of people have kind of used this term or this phrase, delivery is the cure for preeclampsia. And they think that it's just something that can happen in pregnancy. And as soon as the mom delivers, that it goes away. And I think the points that Cheryl was making and that I'd want to emphasize is you can still get postpartum preeclampsia and other issues related to high blood pressure after the delivery. So I really want to emphasize what Cheryl was talking about is what you need to pay attention to for your own health after you go home with baby.
All right, can I jump in there too? Yeah, like I absolutely 100% agree. And I was actually going to suggest to women too, some of the signs that that Eleni spoke about in terms of the symptoms of preeclampsia. A lot of those do also like overlap with other things, right? So women have migraines and they have headaches. So a lot of the conversations that I will have are, you know, a woman asking, well, I get headaches. So how am I going to know if this headache is different or something I should be worried about when I get migraines pretty regularly? And so I encourage women to really ask their providers for some very specific recommendations and suggestions, especially if you already have, you know, acid reflux and get some chest discomfort, or you already have a headache, migraines, and you get headaches pretty frequently. How are you going to distinguish? And a lot of the things that I spend some time talking about are just trying to get more information about what those symptoms are for that individual person and being very specific about the things that would make me concerned or that are different. And I encourage women to ask their doctors and their providers about, you know, some more specific questions about how they can distinguish those things if they already experience some of these symptoms kind of already at baseline, which is definitely they're not uncommon symptoms, but in combination or when they occur in a new fashion are concerning.
Absolutely. Thank you. And I think Dr. Roth is back with us. Thanks everybody for being patient. You know, we're in this tech Zoom crazy world. So all of us have this experience. Dr. Roth, we just had some great chiming in when you dropped off, but you were just about to go through birth. So if you're back on and can hear us, can you just walk through what some of those symptoms are? You talked about post, now you're talking about birth. So maybe you can just go through that.
Right. So B is for bleeding, as I mentioned. And again, I apologize for, I don't know what happened there.
It happens to all of us, don't worry.
Yep. I is for an incision that's not healing well. So an incision that opens, has a little redness or soreness, tenderness in that area that's increasing. R is for red or swollen leg that's painful to touch. You know, could be a potential clot. So we're very careful about that. T is a temp higher than 100.4. Usually we say 100.4. In the COVID epidemic, we're actually recommending greater than 100.0 that you would contact your provider. And a headache that does not get better even after you're taking medication, or especially if it comes with visual changes. So that's H, headache, which of course, as Eleni talked about, is a sign of preeclampsia. So be sure if you have to go call 911 or talk to your provider that you remind them that I have just given birth. I gave birth on this date, or I'm going to give birth on this date. approximately, and that I am having this symptom on the warning signs. So be specific. You know, people that work on ambulances or in the ED may not have the same perspective as someone who takes care of women giving birth. And so you want to be real specific about that with them. There is a new list actually out there from the Council of Patient Safety on Women's Healthcare. It just came out, I think, day before yesterday.
I think showing it.
Oh, great. So it's at safehealthcareforeverywoman.org. It also has a list of symptoms that people should call in for. So, you know, there's good tools out there for us to help know when to call in, but we definitely want you not to sit at home and wonder. We really do want to know if there's something going on with you. There are some...
Dr. Roth, I just want to ask you about the bleeding, because there have been a lot of women, and I've seen a lot of advice where sometimes women are bleeding postpartum, and they may be bleeding so much they even lose track of how much they're bleeding. And by the time they get to the hospital may not even know how much blood they've actually lost. So if the bleeding is happening, what do you say to women about monitoring and checking that so that you can actually let a provider know about that?
Well, it's a good idea for you to keep track of how many pads that you've gone through and what period of time. So if you can tell your providers, you know, I've been through 2 pads in 2 hours, that will be a red flag for us. Or if you can tell us approximately how much, if you had a clot, what size it was compared to something, that's helpful as well.
Great. Dr. Srinivas, I want to ask you a question. You know, so much of what we're seeing in the maternal health crisis are challenges that are relating to heart-related problems, right? And at University of Pennsylvania, you all have started, and you're a part of a program called Heart Safe Motherhood. Talk to us about what that is, and what are you all hoping to do about that, and how are you guys addressing some of these heart-related issues? I think a lot of people are really shocked that there's so many heart-related issues that are linked to challenges with pregnancy and postpartum. So talk about that a little bit more in that program specifically.
Sure, thank you. So I think to sort of dovetail off of what Eleni said earlier about just the fact that preeclampsia, it's a misnomer to say that that it's cured with delivery. The resolution begins with delivery, but one of the reasons we kind of developed Heart Safe Motherhood, which is basically a bi-directional text-based platform that allows us to safely monitor women after they go home and have been affected by preeclampsia during their delivery or pregnancy, or if they're have chronic high blood pressure and could develop preeclampsia postpartum. And just based on the changes in a patient's body after delivery, the maximum amount of fluid sort of that is coming back into your body and could maybe cause your blood pressure to go up as well happens sort of on days like sort of 5 to 7 after delivery, which is really when everybody's home. And I think what prompted us to sort of start this program, and I should say that it's a program that's been successful because it was developed with patients. We kind of developed it together. We got input along the way from a lot of patients, but what we were trying to sort of solve for was when women go home, they're so focused on their baby that we were seeing women come back in heart failure, short of breath, with strokes, like things that if we only could have picked this up days ago, could we have prevented some of these things from happening? And even though women were having some of these symptoms and had heard that they should kind of worry about them, women their focus becomes not themselves. It's really, they're focused so much on their newborn. And sometimes there's barriers to why they can't come in. There's a whole host of reasons that sort of influence kind of their patient's ability to access care in that postpartum period. And so this was sort of a win-win because we give women a blood pressure cuff before they leave. We have a video for them. We teach them how to use it. We give them all these warning signs. And then they get texts. They get a text twice a day that reminds them to take their blood pressure. And what we saw before we developed this was a significant racial disparity in our population around who was able to, so we recognized this as a problem. And so we were having women try to come in for a blood pressure appointment, a few days after they went home. But that's just very burdensome for patients. And honestly, just is what we need is the blood pressure. We don't really need necessarily for every patient to actually be seen. And so
especially now, it's going to be very hard to get them to come in just to put on their blood pressure. Yes.
Yeah. And honestly, even regardless, it's sort of it's really trying to think about a patient-centered way to provide care that allows us to get the information we need and respond. And so it was really amazing. This has been we did a trial and, have research that's shown that this has been helpful and has reduced racial disparities. But now we've been sort of full scale with, this is how we care for all of our patients at Penn Medicine who have preeclampsia, is that everybody gets a blood pressure cuff. Everybody gets enrolled in this automated texting platform. We monitor them twice a day for 10 days. And about 15% of women end up having a concerning blood pressure where it allows us to bring them in or start a medication over the phone. But we then keep monitoring them. Patients really love it. And I think it's been successful because of our partnership with our patients who helped us, trial it, give us some feedback. And so it's sort of a patient co-developed program.
We've had other partners who've requested some of those blood pressure cuffs at the March of Dimes. We've been fortunate through our COVID fund, which has been supported by a lot of individual donors and others, to use some of those funds to provide blood pressure cuffs, especially in low and moderate income areas. And these have been life-saving, right? Because I think what the healthcare providers have been able to do is monitor that blood pressure, identify relatively early if there are challenges, and create some interventions either through therapeutics or some other ways to really save women's lives. So I know that it's all being modeled. Much of it is being modeled off your program. So congratulations. I want to touch on something that you touched on, which is, I started talking about this at the beginning, which is that this maternal and infant health crisis is not affecting women in all the same way. We are seeing disproportionate impact with women of color. We have heard sort of horror stories sometimes of women of color, African American women, who are perceived as being at higher risk or having hypertension at higher rates than other women, and therefore when they present with high blood pressure, they're concerned to often ignored. And so I just would, and we'd like not to think that's the norm, and I'm sure it's not, but it clearly, things are not happening in the way that they should in terms of how care is delivered when these kinds of symptoms show up for women of color. So anyone can jump in on this. Talk to us about how you're looking at different populations and addressing some of these symptoms based on how women present, especially addressing the unique needs of women of color.
I can jump in sort of on a more anecdotal level, because I think a lot of what we're talking about here is really being heard by your provider, and your provider knowing you as a person and really and hearing your concerns. I was very struck when I was talking to women for the book that there was a woman, Hope Williams, in San Francisco, who had high blood pressure when she was pregnant. She's an African-American woman. She kept going back to the doctor. They would bring her to the hospital for a little bit. Then they would just send her home. And she had questions about, what does this mean? Why is this important? Should you try a different medication? She really felt like none of those questions were addressed. And these are stories that we have heard. She did everything, everything, to get the help that she needed. And she ended up giving birth to her daughter at 34 weeks. Thank goodness she and her baby are healthy. But that's the kind of thing that should never have happened, especially in that way where she was never told she was at risk for premature birth. She didn't know that her baby would have to go to the NICU, and there was plenty of opportunity for that to happen. And she had asked those questions many times. So I just want to acknowledge, as we're talking about this, that when I say something like it's important to advocate for yourself, it's important to ask these questions, it's important that everyone be heard and everyone have their questions answered. But of course, everyone is not experiencing that in the same way within our healthcare system. It's not, me going to my doctor and asking these questions. unfortunately, is not always the same for everybody, for African American women, for low-income women, for women, Native American women, and just that we should really acknowledge that really is a reality within our system. Nevertheless, everyone really does have the right to be in partnership with their provider. And it's just something that I want to acknowledge for anyone who's listening to this and thinking, well, I have tried to advocate for myself.
Right.
One thing I totally agree with what Sarah said. I mean, we hear those kinds of stories as well, obviously, at the Preeclampsia Foundation. But at a very practical level, one of the things that we're doing, this May is Preeclampsia Awareness Month, and our theme for this year is check, know, share. And it has to do with kind of raising your own knowledge of your blood pressure and being very directly involved in it, not just relying on your healthcare provider to take your blood pressure when you go in. And as we've noted, like that, the amount of times that you might actually see a provider is going to be reduced now anyways. So in addition to what we were talking about earlier with postpartum checking of blood pressure, this is an opportunity, I think, for women to seize a little bit of the control at a time when you really feel out of control, and take your own blood pressure. Have a blood pressure monitor at home, and we'll talk a little bit about some of the challenges with that. But if you have the ability to have a blood pressure monitor or get a loaner, making sure that it's going to be accurate enough, take your blood pressure a couple times a day and keep a log, because in those instances where you're trying to be heard, nothing speaks to a doctor more than data. And if you can show them a log that shows them the trends of your blood pressure, they're going to be much more responsive to that. Now, we shouldn't have to have an excuse for why they should listen to us, but I'm just saying, like, one more thing in the toolkit to be heard.
And to be a great advocate for your own health and taking your health into your own hands and empowering yourself, right, with tools. And I think that's a great idea. Dr. Srinivas?
Yeah, I was going to say, I think being sort of cognizant of your own numbers and sort of your own blood pressure is important. I think in this pandemic and with this sort of telehealth being supercharged, we've, Stacey, you mentioned getting blood pressure cuffs for certain populations. We've been able to partner with the insurance companies and Medicaid carriers in our area, and pretty much they're all paying for blood pressure cuffs for our patients. So we've been providing most of our patients prenatally with blood pressure cuffs, because it's obviously a critical aspect of care during pregnancy, especially if we're going to do remote visits. And so empowering women to know their own numbers, to take their blood pressures a little bit more frequently at home so we have some more information. The only other thing I'd say is I encourage women to also be upfront about what you value. I think Sarah brought up a couple of different examples. I think different patients value different kinds of information. Some patients want numbers and they want to know all of the possible things that could happen, even if they sound scary. And I think some providers, the style is to not share things that could happen, 2% of the time. Why bring up something that could be kind of scary? But some patients really want to know all of the possibilities, whereas other patients really, that would make them nervous and they actually don't want to hear that. And I think as much as we as providers try to be responsive, I try to tailor, and I think a lot of us try to tailor the information we provide to the patient. And I sometimes find it very helpful as a doctor to say, what's most valuable to you what information is most valuable to you right now? And so I think I would encourage patients to say, I understand that you might not know, but what I would really value is, what do you think could happen? If that's something that would be important to you. And I really encourage women to sort of frame it that way and just explain, I think, be upfront about what's most valuable to you so that you get the information that you want.
Right. And making sure that whatever you value, that you have it, because that's going to provide some comfort to you as you can kind of proceed with pregnancy and postpartum. There was a question on Facebook around wearing masks, and Dr. Roth, maybe you can answer this. There was a question, should a pregnant woman experiencing headache and chest pain, et cetera, really put on a mask, especially during this pandemic? So what is your advice on that?
Sure. Well, the recommendation is if you're going to be transported during COVID, that you do put on a mask if you're able. Now, if it's going to interfere with your breathing or you feel like you can't put one on, absolutely, we don't want that to happen. But the recommendation is, if you can, that you do put a mask on. I do want to just go back to the disparities for a minute.
Yes, please.
I do want to emphasize that people can also, besides talking to their doctor or their midwife or their nurse practitioner, they also can connect with the nurse in their doctor's office. Sometimes they have a little more time and can hear you a little more than the provider can. And, you know, A1 is an organization of more than 22,000 nurses in the United States. And we've been working really hard in the last couple of years on what can we do about the disparities. We find it just heartbreaking that that's true. So, you know, use all your resources, talk to your doctor and to your nurse and, you know, your nurses in the hospital, and do what you can to say that I don't think you're hearing me, so that we can all be on the same page.
And I know one of the things that we're doing at the March of Dimes is we are launching a whole new program on implicit bias. You know, all of us have implicit bias about something. But at the March of Dimes, we feel very strongly that to the extent that implicit bias in our healthcare system interferes with high quality healthcare for all women, we need to really make sure that healthcare providers are aware of what those implicit biases may be and have tools to address it so that every woman has access to great care. Eleni, you mentioned Preeclampsia Awareness Month. Tomorrow is my sister's birthday, but it's Preeclampsia Awareness Day, right?
Well, it's World Preeclampsia Day.
World Preeclampsia Day, that's right. So we have a big day to be talking. This is great timing to be having you here and to be able to talk about some of these issues. But let me ask you a question, because a lot of what we're talking about is sort of clinical care and how we improve these outcomes for moms and babies from a clinical perspective. But, you know, frankly, a lot of these barriers and issues in the healthcare system, you know, really come from a place of really needing substantial policy change. And we've been involved in a big way in advocacy. You guys are at the Preeclampsia Foundation are doing a lot of work on how to improve policies around maternal health. There's a package of bills called the Momnibus Act, spearheaded by a lot of members like Congresswoman Lauren Underwood, Congresswoman Alma Adams. Can you just speak just very briefly in the last few minutes we have about the Momnibus Act, why it's important, why women should be aware of it, not only to advocate for their own health, but to advocate for all moms and babies?
Absolutely. This is, as you mentioned, it's a package of 9 bills that are focused on improving maternal health outcomes for all women. I'm going to very quickly, because I know we're running out of time here, just kind of give you a little flavor of what these 9 bills touch on, because there's something in here for everybody, and they really are optimized to try to address some of the disparities that we're seeing in maternal health. So some of it is around making investments in social determinants of health that can certainly affect maternal health outcomes, like housing, transportation, things that affect our ability to be healthy moms. Funding to community-based organizations, looking at unique things that affect women veterans, and investing in that care coordination, growing and diversifying the perinatal workforce. So we know that that trusting your healthcare provider often means having somebody who you can relate to. And so we really need to invest in a diversified workforce. Certainly improving the data collection processes and quality measures, investing in maternal mental health. I mean, I will tell you from the preeclampsia community that when you've been through a train wreck, it will mess with you mentally, emotionally, and so recovery from that needs some special resources. Some digital tools like telehealth, and I'd love to have more time to talk about that because that's an area we're passionate about. And by the way, side note, one of the reasons I referenced this about having a blood pressure cuff at home, one of our concerns, we're big advocates of empowering women with this kind of tool and knowledge. We're very concerned that if we don't do this right, we're actually going to increase the digital divide or the technology divide. and contribute even more so to disparities, because we want all women to be able to take their blood pressure cuff, not just those who can run to their drugstore and buy one.
Absolutely.
And then having some innovative pay models and continuity of healthcare insurance. This is a big piece. We're really trying to get that coverage period extended to 1 year, because we know a lot can happen in that 1 year after birth. So that package is the Black Maternal Health Momnibus, and there are many organizations like the March of Dimes, like the Preeclampsia Foundation, and others who are very actively advocating for it.
Absolutely.
I wanted to just say that I'm a maternal fetal medicine provider and on the board of the Society for Maternal Fetal Medicine, that I know we've been a strong partner and advocate as well for all of the things in the Momnibus Act. And I think just the focus on sort of improving care delivery models and innovating around care delivery and really focusing on, I just wanted to emphasize what Eleni said about the digital divide, because I think while we all think that, and in our Heart Safe Motherhood program, we've shown that if done in a certain way, you can absolutely reduce and eliminate really racial disparities with regards to certain types of outcomes. But we have to be very cognizant as we sort of start kind of trying all these innovative models of care, that we get patient input, that we develop them sort of in partnership with patients, and that we really are attentive to not worsening disparities.
So I think one of the things that, we can take away from all this, first of all, listening to women, listening to their concerns, listening to their symptoms, women monitoring their symptoms, and especially during this pandemic, if there are serious warning signs, telehealth can be an option. We do have challenges with telehealth with respect to women who may not have access to those kinds of tools. There may be a digital divide for many women, but to the extent it's available, it's great. But the point here is that if you have serious symptoms, there's nothing that's going to replace being seen by your doctor and going in to see your healthcare provider when you need to. And I think the point was made earlier that the risk of doing so in the midst of a pandemic is far less, the risk of becoming sick during the pandemic is far less than something that could happen if you have a very serious symptom, either during pregnancy or postpartum. So I really appreciate all of that we want to make sure women are monitoring their health, that they're in partnership with their healthcare provider. Sarah, to your point, that they're feeling heard and feel they can advocate for themselves. And this has been a great session. So I want to say thank you to all the panelists for joining today. Know the warning signs, when to see your provider during pregnancy and postpartum, and especially during this pandemic, staying as safe as possible and seeking the help that you need. And if you're a woman of color, making sure that you are clear about your ability to advocate, that you deserve to be heard, and that is the obligation of our healthcare system to respond to your needs is the most important point for all women, and especially women of color. I just want to share before we go some additional links and resources. There certainly, I know, have been a lot of links that have been shared, but here are some as well. If you want to do some follow-up, there are signs and symptoms of preterm labor and COVID health information at the March Dimes site. Great resource on post-birth warning signs, articles at healthformom.org. A1, Preeclampsia Foundation, CDC are full of information, and obviously you've heard from A1 and Preeclampsia Foundation today. There's also a resource at the Postpartum Support International and their website as well. So if you want more information on any of these issues that we talked about today, please don't hesitate to follow up and go to these links. The last thing I'll just say is that we just had Mother's Day, and now we're already turning our attention to Father's Day. And at the March of Dimes, we want to celebrate partners and fathers as well. And we're doing something really special. All of this work here with our Facebook Lives are being brought to you with the generosity, as I mentioned, Merck for Moms, but we're also doing a really special event to honor fathers. So if you're interested in helping us to continue to do this great work at the March of Dimes, we really want to invite you all to help us raise over $10,000 between now and Father's Day. That's $1 for every baby that will be born each day between now, and we started it a little while ago, and Father's Day. So Please, we always appreciate the very generous support from all of you all, and appreciate all the support from our donors and our partners. I want to say that we didn't talk a lot about maternal mental health, but that is obviously another warning sign that we should never, never forget. I think every one of these webinars, we've spoken something about, and someone raised it earlier here, about maternal mental health. It is a critical warning sign that we want to make sure every woman is tracking, and making sure that not only does she feel well physically, but that she's doing well with her mental health as well. We've had webinars on this. We are going to be having another one next week. So next week on May 28th, and this Healthy Mom, Strong Baby series, we're going to be having another conversation about maternal mental health and adjusting to a new normal, whatever that new normal looks like now that we're in the midst of a pandemic, and we'll be in this place for a little while. So again, I want to say to Dr. Srinivas, to Eleni, to Sarah, and to Dr. Roth, thank you both. Thank you all for joining and for being a part of this great session. And thanks to all of you all for joining us today on Facebook Live. And we look forward to seeing many of you all. Share this with your friends. Make sure that your friends who are pregnant, who are thinking about being pregnant, who've just had a baby, know about these. And we look forward to bringing you some great information as we move forward over the coming weeks. So thank you all so much. And thanks again to our panelists.
Thank you.
Thank you.
Thank you.